This is Erin Coop again at JBI. The next episode in our series of Best Practice Information Sheets podcast is on best practice information on the management of constipation in older adults. This best practice information sheet, which supersedes the JBI information sheet of the same title published in 1999, is based on a systematic review and best practice guideline. It is Volume 12, Issue 7, 2008. Background. The term constipation refers to difficulty during defecation and infrequent bowel movements over an extended period of time. There is a link between aging and likelihood of constipation for those 70 years or older. Risk factors for constipation include fluid intake, diet, mobility, environment, and other factors such as anxiety, depression, and impaired cognitive function. Objectives and types of intervention. The purpose of this Best Practice podcast is to present the best available evidence for the management of constipation in older adults. Interventions consist of traditional medical therapies for managing chronic constipation. Patient assessment and management of constipation. First, we'll talk about patient assessment. The aim is to identify lifestyle factors impacting on a person's bowel function. The person's normal bowel pattern, toileting preferences, and current status should be determined. Any symptoms of constipation should be identified, for example, nausea, abdominal pain, or hard stools. Now, moving on to management of constipation individualized according to each person's needs. Initial management of acute constipation may include suppositories, enemas, or osmotic laxatives, followed by a bowel management program. Management of chronic constipation may include bulking agents for people with low dietary fiber or osmotic agents. Bulking agents are effective for ambulant elderly, whereas osmotic or laxative agents are more effective for bedbound people. Fecal impaction needs a special bowel management program that includes enemas as well as osmotic or stimulant laxatives. Recommendations. These recommendations are based on moderate to strong evidence that merit application in clinical practice. As the old saying goes, prevention is better than cure, so it is recommended that older adults receive advice and education about hydration and a good diet with fiber sources. Older adults should be screened for history of medication use, especially polypharmacy, and cognitive status. Monitor and record bowel movement for frequency, character, pattern, episodes of constipation, and use of oral or rectal laxative interventions. Osmotic laxatives such as PEG and lactulose, and bulking agents like psyllium and bran are beneficial in managing constipation in older adults. Well, that's all for this episode, and as usual, we'd love to hear your feedback on this podcast. Thanks for tuning in.